Hi, everybody. I'm Amy Post. Thanks for joining me for my podcast today. As always, I appreciate your time. It's something that we certainly can't get back, so anything that you guys can give just to give us a watch, we certainly appreciate it. And I've appreciated all of the encouragement that everybody's been giving on messaging me and just really reaching out to tell me about the podcast and just encouraging every bit of it, because this has been certainly something brand new. But when I started the podcast, I let you know it's going to be just all kinds of threads of different information. And hopefully you guys are enjoying the different guests. We're just going to dive into everything that's raw and real. But recently I've been doing a lot on health and kind of getting healthy from the inside, doing something a little bit different, but also diving into self-care and attitude. And so this really just goes right along with it today. We'll get started. But today I have Pat Bauer. She is an adult nurse practitioner with Wildwood Integrative Health here in St. Louis, Missouri. Hi, Patricia. How are you?
I'm well. How are you, Amy?
I'm doing great. Thank you so much. So I really wanted to have you on today. The listeners may not know I actually saw Pat and have been a patient for a very long time. And when I first saw Pat, it was when I was extremely sick. And this was a situation where I was diagnosed with a staph infection in my sinuses, and it was very serious. I couldn't get out of bed. We didn't have too many options. And so finding you was just a blessing. So I really had the opportunity to learn about different treatments that can be done that are just a little different than what we may know about. And I love the fact that there's so many different things that you offer depending on what the patient needs and really what's going on. Because I think what I appreciated most was the time that you spent with me in the beginning, really asking a lot of questions, diagnosing it, and just trying to figure out what we needed to do, but what was wrong. And I think that's a lot of the issue with healthcare today. We really don't have a lot of time to spend with patients to really diagnose them. And not only does it give you an ability to get to know the patient, but it gives them a feeling that you really care and you're really trying to get to the bottom of it. And so I think for anyone who is looking for some alternatives with their health, if you're ill, it's great. And even if you're not, keeping it in mind for when the next time does occur, or maybe you have somebody that you can pass this information along to. So we'll get started. Pat, just tell me a little bit about Wildwood Integrative Health, when it started, and then what you do.
Okay. I went back to school to become a nurse when I was 50. Lots of life changes right about then, and those life changes caused me to realize a dream, which was I wanted to be a nurse when I was 11 years old. So it just took me a little while. I got married, had kids, owned businesses, and once I became a nurse, I knew that I wanted to. I raised my children knowing that they're resilient, they get better. So many times they're sick, but the good Lord made the body to heal. And so I became a nurse, and I saw a lot of heavy interventions, some of which, thank goodness, people know how to intervene in emergencies. And so I saw all that and then thought, I want to help the body heal. I went back, became a nurse practitioner, and in 2015 I opened Wildwood Integrative Healthcare, and it was 2 IV chairs, and it was just a receptionist and I, and we just slowly got into all the alternative methods for healing. And they're anything from IV vitamin C. I used a lot of ozone. That's a form of highly absorbable oxygen. That's what helped you and helped you overcome your infection. And then now I have a hyperbaric suite, getting ready to bring on my second hyperbaric chamber, which is an acrylic chamber that's pressurized with 100% oxygen. So if someone were to ask me, what do I do? I help people heal, giving them all the raw materials, and the person does the healing. And it is, like you said in the intro, it's in your heart and your mind. And if I can work with someone who wants to heal and whose mind is open to researching and then finding out their little piece of the puzzle, it makes my job easier, and I just love what I do.
That's wonderful. I think it's Very spot on, like we talked earlier about the attitude and what you're telling yourself. If you're not going to get better, you probably won't get better. If this is not going to work for you, it probably won't work for you. But then flipping the switch, I do want to get better. This will work. I think that we want something to work or we don't want it to work, and the mind absolutely will follow.
Yeah, and I have a Christian belief. I believe in God the Father and the Son and the Holy Ghost. And when I meet someone who has a deep spiritual connection, and it doesn't matter what path they're taking, I can usually tell somebody's got that developed connection, and those are the people that do well because they've peeled back all the pomp and circumstance that humans like to add. I'm this and I'm that and I did this. The people who do the best, they've pulled all that away to see that we are spiritual beings having a human experience, and they're the most beautiful people. And some of the people, I take care of a lot of cancer patients. Some of those people, this is the last part of their journey here, and so they do pass away, but they pass away as beautiful as a soul can be. And maybe it's me being able to see it, but I see some huge development and openness and gratitude, and I'm blessed to be able to help them through that. And then on the other side of the scale, I see people come back from really heavy-duty diagnosis, and they get better and they get to go live their life. So I'm thrilled to be able to help.
That was fantastic. Tell me about some different patients that come in to see you. I know we've talked about the cancer patients and those that are like myself as well. I was in pretty bad shape, and I don't know that anything would have taken care of what I had, being the staph infection. What do other people come in to see you for?
I would say I see a lot of patients for thyroid disorders. Hypothyroidism is rampant, and I tend to use desiccated thyroid, which is porcine derived, and it matches our thyroid exactly. I found that some of the synthetic thyroids, they make a person's labs look great, but they still have symptoms. So they can have hair loss, they can have fatigue, they can have constipation, and their physicians aren't listening to them. So they come to someone like me and ask for help. And once I do the deeper dive on some of the labs and listen to their symptoms, oftentimes all they need is just a little bit of thyroid to help their body regulate metabolism. And then along with that, I always look at hormones, because I think aging is nothing more than the lack of hormones. And I always have my patients think of their grandparents, grandmother, grandfather, and when they're 60, they're vibrant, they're able to go and do and live, and by the time you're of cognizant age at 20 or 25, and then you look at your grandmother or grandfather and they're frail, they're small, their muscle mass is gone. And so the learning that I've done tells me if we can just slow the aging process by giving a minimum hormone replacement therapy, I don't want to put anybody back to the hormone levels of when they were 30.
Right.
But if you can move forward in time and just age slower, I think that's what we want. I've never met anybody who wants to be Superman or Superwoman. They know that life moves on, but you want to be healthy, and you don't want to have to take a handful of medicines. A great niche to be in, and I work with a lot of other providers because I'm only a piece of the puzzle. And I work with chiropractors because I think once the person's spine is aligned, then all the information gets to all the organs and the systems, and you're setting the stage for healing. I work with physical therapists, I work with even some standard care MDs and DOs. They're very interested in that hyperbaric and the effects of oxygen and healing. It's a great niche.
And I think we've all probably heard this hyperbaric chamber, but just give us a little bit more description on what it is and what it's used for.
Sure. Hyperbaric chamber is oxygen under pressure. The chamber that I have can go from 1.5 atmospheres, and I run it up to 2 atmospheres. And an atmosphere is the amount of pressure we have. So we live at 1 atmosphere of pressure. And when a person gets in this acrylic chamber, we're pressurizing it with 100% oxygen. As you and I are here, we're breathing about 21% oxygen in our atmosphere. We can put you in that chamber, pressurized, and the oxygen will be absorbed through your skin, but mostly through your inhalation into your lungs. And then your system becomes saturated with the very thing it needs to initiate or maintain health. So I have a lot of cancer patients who will get high-dose vitamin C and then get in the hyperbaric chamber. I have some Alzheimer's and dementia patients who do very well with oxygen under pressure. I have some traumatic brain injury patients who, for lack of a better word, they wake up and they're more engaging with their parents. Lately, I've had several information, and it's just oxygen.
Wow.
The chamber I have is what the hospitals have. It is large. I had to redo a suite in my building. We've all gotten trained by the Hyperbaric Society, and lots of people and doctors really understand that giving high-dose oxygen helps people heal. The interesting thing to add about hyperbaric oxygen is that there are 14 diagnosis codes that allow hyperbaric oxygen to be paid for by Medicare or private insurance. But if you don't have one of those diagnosis codes, you cannot get in the hyperbaric chamber at a hospital. Thank goodness the hospitals have them, but they're very narrow in how they can allow people to get in. I have an interesting story. A patient came in and she had asked about the cash price to get into a hyperbaric chamber at a local hospital. And the long story short, it was $3,800 an hour.
Wow.
And for my chamber, I charge $250.
Wow.
I make it affordable. Does one session work? No, you have to have multiple. You usually see improvements after the 5th or 6th session. The closer together you have them, the faster the improvement. And you do have to have a maintenance after you attain your goal. Recently, with my Alzheimer's and dementia, I've been working with some people who get peptides for brain function.
Okay. Just very interesting.
When people are being cared for on multiple levels, they just wake up. And I see, like one gal, early onset dementia, and she's been in the hyperbaric, maybe she was in 10 or 12 times, and she began to go brush her teeth on her own. And she could function better on her own, get in and out of a car in a more normal fashion. So it's been fun to hear the reports that my patients have because of increased oxygen.
Yeah, and it sounds so simple, but we don't think of those things very often. And I love that you keep it very affordable, because I think sometimes we aren't sure what that even looks like. An alternative option, I think the first thing you hear is, if insurance doesn't cover it, I can't afford it. But you keep things really affordable when it comes to all of your options. And I love that, because the other physicians that you have referred us to, they absolutely keep their price very affordable. So that's really nice.
I think that when you meet somebody who's in the healthcare field and they are a true healer, that's what we're here for. And understanding that insurance is a necessary evil. It's absolutely necessary for catastrophes. But when you look at keeping yourself well, to be able to afford it, you have to have a high deductible plan. And so what a lot of patients are figuring out is that they're going to take that, what they would pay for their deductible, and they're going to make an investment in their health, whether that's they're going to spend $5,000 keeping themselves well, or $10,000 keeping themselves well when they get big diagnosis.
Right.
Now,
Right.
we should all do our best to eat properly, get plenty of sunshine and good exercise and be in healthy relationships, all that. We shouldn't ignore it. But if you get a tough diagnosis, then by all means, you have to slow down, break it apart, and see that your health is your responsibility.
Yeah, absolutely. And I think earlier we were speaking about, I've had so many individuals that have been diagnosed with cancer, and I'm sure I'm not the only one. I think I've just been hearing it so very much, that it's very scary. They don't know the treatments or what to do, but I think this is something to really keep in mind for anyone that knows someone that has been diagnosed with anything. You rattled off all kinds of things that I don't think we have even thought about, dementia and different things, Alzheimer's. It's absolutely just, it seems like the list is never ending of what can be treated, and the health can increase and get better no matter what it is.
Right. I tell people there are lots of people like me who are doing alternative healthcare, and find the one that fits with you so that you never feel ignored or unheard. Healers need to take the time to hear the whole story. And does it take 2 days to do that? No. But if the practitioner can sit and listen for 30 minutes, just listening, I can see what path the person has taken, where they want to go, because they'll tell me what feels good for them. And then I can work with them. And sometimes it's very interesting. I'll get someone and I'll get to be the hero because I gave them just the right treatment at just the right time. And other times I'm the first stop and they move on from me, and I'll hear a year later or 6 months later that someone did well, and I'm just as happy for them, because health is in here, and sometimes we have to peel the layers of the onion back, and that first one may take months, and time happens, life happens, and I may not be the one to get them to health, but the second or third person who's working with them on their health, they may be the ones. My job is always to help people move forward into health and to living their life rather than being controlled by a diagnosis.
Yeah, absolutely. And I think it's just so encouraging to hear all of this and giving people encouragement and hope that there is something else out there. All they have to do is just do a little research, come and see you, and really talk through things, and I think that's great. You touched on the vitamin C infusions, and I know I've had them, my husband's had them, many people have had them, but dive in and just tell us a little bit about the different infusions that you have and what they do.
Sure. So the base of many of my infusions and what people will see a lot of alternative caregivers give is vitamin C. First of all, you can take it orally, but you can only get to what's called bowel tolerance before you have diarrhea. And taking that many pills or that many grams of vitamin C, it becomes hard to do. And you can't take as much as you need when your body is stressed. At my clinic, I do 25-gram vitamin C, 50, 75, and 100 gram. And the 25 gram, let's say someone comes in and has a sinus issue or they have upper respiratory. If I can give them 2 IV vitamin Cs, and then I'm always asking them, did you take your vitamin D? Yeah, I'm taking it, and then I'll go look, no, their vitamin D level was 40. No, I want that vitamin D level at 80. And if it's 90, I'm happy. Because the higher your vitamin D level, the stronger your immune system. Let's say you start getting sick and someone wants to come into a person like me and I'm going to give them 25 grams of C with magnesium, some of the B vitamins, maybe a little potassium or calcium. But when they come in, I want them to add a 5,000 D. Even if they're already taking that, when they're sick, I want them to take another one. And can you take too much vitamin D? Yes, you can. But in a short term, in an acute situation, adding an extra 5,000 for several days is going to reduce the duration of your illness and the intensity. And that goes for crazy viruses that are out in the world. If you feel something coming on, just increase that vitamin D, come and get a vitamin C. I do the higher doses. Some of the walk-in clinics will do 6 or 7 grams of C. Nothing wrong with that. You just probably need a little more. I should mention that in order to be treated by me, you have to have a new patient visit. And I think that's the way it is for a lot of healthcare providers. What we need to know, what I need to know, is what's going on with the person. What's their history? I do a brief physical, and then I feel comfortable having my nurses put in an IV and then watching them progress, changing the course if need be. So it does take a little while to get into me. Right now it's about 6 or 8 weeks. But once you're in, you're my patient for life. Even if I don't see you for 5 or 10 years because you're living the good life, if you call me up, you're in. And I want that kind of long-term relationship with my people.
Mm-hmm. Yeah, absolutely. So now we've known each other for several years, and I think anytime we have something coming on, it's just great to be able to pop in and get on your schedule and not have to take pills or not then worry about what's going to happen. Tell us a little also about patients that come in for pain and what you can do for them. I know my husband has seen you for different things, like his ankle or his knee was hurting, or just different ailments that those are hard. Sometimes we don't know what to do for those because it just doesn't seem like a lot of options. And you call your doctor and put some ice on it or whatever, or get a shot. And I think some of the alternatives that you offer are probably much, much better. Kind of tell us about those and dive in just a little bit.
Okay. I do an injection called prolozone, which is a combination of procaine and ozone. And procaine is a numbing agent, and ozone is O3. It's highly absorbable oxygen. And the way it's made is, in nature, I always explain it to my patients, nature makes ozone when lightning goes across the atmosphere. And that electrical charge makes O2, O3. So that ozone, the clean smell you smell after a rain, is ozone. And what we do in the office is we have a little machine, and it's basically taking medical grade oxygen, running a current across it, and O2 becomes O3. It has a very distinct smell. I put it in a syringe. It's heavier than air. It looks like injecting air, but it's really ozone because I always let my patients smell it. And what I do is, let's say it's a low back, and they've been to their chiropractor, they just have a chronic, let's say, sciatic nerve pain. Mm-hmm. And I know where the landmarks are, and it's a little tiny needle stick, and the procaine goes in, and then I change the syringe, and then push in the ozone. I'm not in a vein or an artery, so there's no chance of embolism, but I'm close in the sciatic nerve. I'm down by the sacrum, and that big nerve that comes across your cheek. So I'm right in that area. It's numb, and then the ozone, maybe it's 2 to 4 cc's of ozone, so it'll feel like a balloon. And then I'm just moving up and down where the person has pain. And they'll feel nice because they're numb. And then I have them come back in 1 week. And I ask, where's their pain? What's their pain level? Did we get anywhere? And invariably, they get some pain reduction. And then I always ask them, where does it hurt? Tell me where it hurts with your hands, because pain will move. And it's not that it's one pain going from here to here. It's that pain goes on in layers. And I may take this pain away, and now you can feel pain a little bit higher up the landmark, so to speak. And so the prolozone injections are weekly until you don't need them. And I'm always in conversation with the patients so that they can tell me, you know what, Pat, I'm pretty good. So then I'll put them out 2 weeks, and then by the time we get to being 3 weeks apart in the injections, most people will call and say, hey, I don't need it. And that's my goal, is that people don't need it. But again, I'll tell them, usually I'm treating people who are 35 and above, and if they have some gray hair like me, we know not to do what we did to get that pain. And I say, if you hurt at all, don't power through the pain. Just come right back in. We'll get you in within a day or two, and it will calm everything back down. The prolozone, it's a German therapy, and I learned the technique from Dr. Frank Schallenberger out of Nevada. And he brought it over from Europe in the 1990s, and I was fortunate enough to be able to get in one of his classes and learn the art, and my patients get better. I just enjoy it.
I love it. That is fantastic. Wow.
No.
So what does your patient age range look like?
I'm an adult nurse practitioner, so I can treat anyone over 18, and then just the whole lifespan. I would say the majority of my patients, 60-40, are women. The probably age range 40 to 70 for men and women. And they're the type of patient that they want to get to the bottom of it. And in St. Louis, there's a lot of us who do this type of healthcare, and that's what we're going for, is why does the person have this pain or have this diagnosis or have this symptom? And I think healthcare is changing because we can't just be monetized. When we're monetized, it becomes cold and hard, and people know nobody cares about them. They care, the system that only monetizes them cares about what their diagnosis code is, how much money they're going to make from the person, about how many days will they be in the system. And people don't want that. And we shouldn't do that to our fellow human. We should have compassion and blend all the capacity of modern medicine to diagnose with the ability to connect one-on-one with someone, get to the bottom of it, give them their choices, and let them move forward, and you go where you go.
And I think it's also really important for people to understand that it's not one size fits all. What you're doing is customizing, and I think everyone that we have met in the industry that you've referred us to, everything is customized.
Thank you for listening to this week's episode of the Advocacy and Hope podcast with host Amy Post. Please check out the show notes for all of the guests' bios and information and links to follow to learn more even after the episode. Be sure to subscribe to the podcast so that you don't miss any of the upcoming episodes, and please share it out to those who need to hear this inspiring message. You can subscribe, rate, and review all of this on your favorite podcast platform, and we sincerely thank you for spending some time with us today.